Welcome back to the Ibrahim Governance Weekend. I'm Zainab Badawi, your host, and I join you from central London. Well, now we're going to move to our first discussion, and I'm really pleased to introduce our moderator, my good friend, Jendai Fraser, and of course she is a former US Assistant Secretary of State for African Affairs and also a fellow board member of the Mo Ibrahim Foundation. So, Jendai, you look like you've got quite a crowd there with you, and you're going to be talking to us about the impact of the COVID-19 crisis on Africa's health system. So, I'm going to hand over to you, sister.
Thank you very much, Zainab. It's a pleasure to welcome all of you to the Ibrahim Governance Weekend on this first forum session on health. We have a stellar group of panelists that I will introduce in a minute, but in setting the scene for this panel, we have the excellent research and report of the Mo Ibrahim Foundation's research team. And from that report, we know that strengthening Africa's health capacities is an urgent priority. We also know that African leaders responded extremely well to the first wave of the COVID-19 pandemic, instituting many containment measures, including international travel restrictions and contact tracing. Mostly, that first wave was mild, affecting mainly Northern and Southern Africa. Africa accounts for 3% of global confirmed cases and 3.8% of reported deaths. However, Africa's average case fatality is 2.67%, higher than the global average of 2.1%. And so we are sure that these containment measures were extremely important, but are we sure of our numbers? Only 8 African countries have adequate death registries, and there are fundamental gaps in relation to health and civil registration. So we really need to look into this question of the numbers. We know that the second wave was significantly sharper, and we may even be entering a third wave that's emerging. That's the good news of adequate and actually better than adequate response. The bad news is that this pandemic has revealed structural weakness in Africa's health system. It's not surprising. We've all known that there are too few doctors, nurses, hospital beds, especially compared to every other region in the world. There's a lack of clean water, basic infrastructure, sanitation services in sub-Saharan African hospitals compared to the world. This really reflects the low priority, speaking frankly, that African governments have placed on health. Only 1.9% of GDP goes to domestic public health expenditure, which is of course below the global average of 5.9%. And this is despite the 2001 Abuja pledge that targeted allocation of 15% of government budgets towards health expenditure. Because of this, and because of COVID-19, other lethal diseases such as malaria, HIV and AIDS, and TB are emerging as the focus is on COVID-19. This lack of investment is also revealed in the stark reality of Africa's external dependence on vaccines. Africa has 18% of the world population, but yet its share of vaccines is only 1.7%. These numbers as of early 2021. Only 10 local vaccine value chain players are currently operating in Africa, in North Africa, South Africa, and Nigeria. So we need to look critically at what must happen for vaccine production to be real. And then finally, let me just say in terms of this overview, prevention is key. It's less costly in lives and in livelihoods. So what are the important initiatives and plans that have been put in place, in motion, that are going to help us to do what's necessary to stop the next pandemic, or at least to stop the next disease outbreak from becoming a pandemic level? So to discuss these issues, as I said, we have an outstanding panel today. Let me just introduce briefly the panel, and then we'll get into the first round of discussions. But before I'm going to introduce the panel, but then we're going to have a keynote speech from Dr. Tedros, and then we'll go to that first round of discussion. So we have President Ellen Johnson Sirleaf, who needs no introduction, as no one on this panel needs an introduction, but she was the former president of Liberia, and especially important for us in this context is she was a co-chair of the panel on pandemic preparedness and response that was mandated by the WHO. We also have Dr. John Kangason, who is the director of the Africa CDC, and who has been instrumental in building Africa's capacities, including upgrading its testing capacities and preparing for vaccine manufacturing on the continent. We have Dr. Agnes Ngwaho, who was the former health minister of Rwanda and chair of the Africa-Europe Foundation's Health Strategy Group. Ms. Rita Roy, who's the CEO of the MasterCard Foundation that focuses its, should I say it, Rita, over 30 billion in assets towards Africa's development. She never likes me to say that. Then we have Gail Smith, who's the US State Department's coordinator for global COVID response. And we all know her as the beloved head of One Campaign and also of the USAID, former USAID administrator. And then we have Mandeepa Global, who is the Mo Ibrahim Foundation's Now Generation Network representative, who will bring us the youth voice and perspective to this forum. So thank you all for participating as panelists. We will get started in just a second, but now we will go to the keynote speech by, or keynote remarks by Dr. Tedros, the WHO Director General.
Excellencies, dear colleagues and friends, thank you, my friend Mo Ibrahim, for the opportunity of saying a few words today. Although Africa has not yet seen the same scale of devastation from the COVID-19 pandemic as some other regions, the impact has still been profound for lives, livelihoods, health systems, and economies. The poor and vulnerable are hit the hardest. Africa has not escaped COVID-19, and we cannot let down our guard. What has happened in many other parts of the world can also happen in Africa. So far, Africa has administered just over 31 million COVID-19 vaccine doses, or 2% of the global total. This is nowhere near enough. WHO is working day in and day out with COVAX to bring immediate solutions for equitable vaccine distribution. But it's clear that Africa cannot rely solely on imports of vaccines from the rest of the world. We must build that capacity, not only for COVID-19 vaccines, but for other vaccines and medical products. The private sector will be essential in this effort. The pandemic has also underlined why it's so important to invest in universal health coverage based on primary health care and strong community engagement. How can we take on a new and deadly virus if we cannot provide care for basics like maternal health care and the treatment of diabetes? Global health security begins in our local clinics and health systems. I thank you.
To have an African at the head of the WHO during this global pandemic. So let's get to it. In this first round of questions to the panelists, what I'd ask you to do is think about 1 year after the start of COVID and looking forward, what are the main priorities or 3 points we need to think about and work on? And then I'll ask you from your unique perspective. And let me just start with Dr. John. Dr. John, can you share with us the current situation as far as COVID impacts are happening now? Is there a third wave coming? And what should be the priorities for action now?
Thank you. And let me start by really recognizing and thanking the organizers for making me part of this very important panel, the very distinguished panel. And we are seeing an evolving pandemic on our continent as we speak. Just between last week and this week, we saw an average increase of about 14% across the continent. So there are two patterns of countries that we are seeing. One is those countries that are moving towards
voluntary or licensing.
Those countries that are moving slowly towards the third wave, and then the other countries that they have actually they are battling to bring down the second wave. I think that is very obvious. I must add that it is also likely that in the next coming months, we'll begin to see some countries that have gone through the third wave begin to edge towards the fourth wave. So I think that is so the point I'm making here is that the public health measures that we have put in place have at least enabled us to make good progress. We've not been devastated to the extent that was predicted initially. And this is not because of lack of numbers. Clearly, the pandemic in Africa is a puzzle because we absolutely know that many more people than the 4.8 million reported have been exposed to the virus. Our own serologic surveys conducted within Africa CDC among several countries speak to that effect. We've seen studies conducted in Nigeria that speak to that effect. In Lagos, for example, about 20% of the population there have actually been exposed to COVID. But the puzzle is that, and this is for sure, that even if we underestimate the mortality rates, which is now stands about 130-something thousand, by fourfold, it is really not a reflective of a devastating pandemic in terms of mortality on the continent. We have seen, unfortunately so, in India, where the virus, the pandemic surprised the country, and the devastation there was very visible. I think that is for sure. So there's a paradox or a puzzle between the large number of people that have potentially infected and the low rates of, the relatively low rates there of mortality. But let me just end by saying that my greatest fear in this pandemic is that we will begin to normalize deaths. I mean, here I am referring to 130,000 people as if there was 130 people. No, when Ebola hit in West Africa and within 2 years, about 12,000 people died, we said never again. And here we are 4 or 5 years later with a devastating and raging pandemic that has claimed about 130,000 lives in Africa. But as we compare with the rest of the world, we begin to normalize deaths in Africa, which is extremely unfortunate.
That's a great point, Dr. John, absolutely. Let's turn to President Ellen. You just completed the panel for pandemic preparedness and response. What are the 3 priorities we need to think about and work on to end this COVID-19 pandemic and to stop further outbreaks from becoming pandemics?
Thank you, Jendai. Let me first comment on the quality, just commend the quality and depth of the MIF key findings on COVID-19 in Africa, which I'm still reading. It has a lot of information and analysis in there. There's little that I can say about the lessons from the pandemic, as Dr. Tedros has spoken, and others that will come on in the panel are equally informed. So I will be brief in summarizing the key elements of the report of the independent panel for preparedness and pandemic preparedness and response. The full report, of course, and the accommodating studies are also available online. We use 4 overarching questions to guide our work. First, how did the pandemic happen? The evidence is clear. A virus outbreak identified in Wuhan, China in December 2019 was not timely addressed, resulting in a pandemic that spread to every country in the world. As the virus spread, because of lack of action, February became a lost month. Second thing we use, why did it happen? Countries were not prepared to respond to the pandemic threat despite years of warning. Valuable lives were lost while the virus spread. Information was hoarded and response bogged down in exchange of official emails, letters. Truths, some countries responded successfully, but many, including some of the wealthiest, devalued science, denied the severity of the disease, delayed the response, and sowed distrust among their citizens. What is the effect? COVID-19 continues to cause devastation. It has cost over 3.5 million lives, including 17,000 health workers, and will have wiped out $10 trillion in economic impact by the end of the year. It has pushed up to 125 million people back into extreme poverty, creating immense suffering to women and girls, and a sharp increase in domestic and family violence. Now we get to how can we prevent it happening again? And I will mention two major things and then go into a little bit of details. First, and I think Dr. Engelkong will agree with this because he spoke to it. First, stop transmission of the current virus. This requires immediate action, such as vaccines redistribution, provided in an equitable manner worthwhile. Second, transform the international system of pandemic preparedness and response. For the short to longer term, there are 5 major recommendations of the panel. And I will just go through them very quickly. Transform the current Act A into a truly global end-to-end platform to deliver the global public goods of vaccines, therapeutics, diagnostics, and essential supplies. Voluntary license or waivers and technology transfer to promote vaccine manufacturing in other regions and countries. I believe that has already been touched on by some. The next is to strengthen national pandemic preparedness and response capacity on a multidisciplinary and whole of government basis. A third is to elevate global health threats through a special session of the United Nations General Assembly with a political declaration that would establish a Global Health Threats Council at the highest level, head of state or government. Next is to strengthen the independence, authority, and financing of WHO, shifting from earmarked funds to increased assessed contribution to enable them to promote a new agile and rapid surveillance information and alert system based on full transparency. Finally, to create an independent pandemic financing facility to raise additional reliable funding for pandemic preparedness, including rapid surge financing and response, all channeled through existing institutions. Those, I think, are the summary things that the panel, of course, the details are all in the report. All of the evidences, the data that have been prepared are all available. But I thought for this purpose, with everybody speaking, I would just try to capture the main elements of how we approach the work and what are the major conclusions. So, Jandal, thank you for that.
Wonderful. Thank you very much. That's very, very concrete, and we appreciate it. And Gail, when I come to you, I'm going to ask you, if the West, the U.S. government can be supportive of some of those initiatives. But let's turn to Dr. Agnes now. And we've seen improvement in health technology as a result of the COVID-19 pandemic in Africa. What opportunities does that present for low and medium income countries in Africa? And what are the limitations? What should be the priorities?
So thank you, Jedi, for, first of all, for having set the stage so well for this discussion, a very important discussion. And thank you also to the foundation of Mo Ibrahim to have us all here. I'm very honored to be with the member of this distinguished panel. So that's true that we have seen emerging innovation due to the pandemic, but it's not, we condemn now, but it's, Africa is a country, is a continent where in many countries there is innovation. We just not look at them. When, for example, there are countries who have innovated so much and discovered so many and developed so many capacity that they can today produce vaccine, but it's denied to them. And a big percentage of the innovation are coming from Africa. But don't forget also that mobile money, a long time ago, were invented by a young man in Kenya, etc. So there is a lot of innovation, and thank you. Thanks God, and thanks all those scientists for this. Even the creation so rapidly of so many vaccines, even if it's not shared equally across the world, but they have been discovered and they are safe and they are working. We can see across the world how it is protective. But also the innovation is to use what has been there and totally underused with new program and new strategy to use them, like the drones, to bring in a far remote area the necessary drugs and tools to save people, like robots, where there is not enough health workers to take the blood pressure and the temperature that can be used. And also decrease the risk of exposure when you don't have enough PPE. Like the monitoring e-base of the movement of truck in East Africa, among the countries of East Africa, so that we can, the people, the institution in charge can monitor where the truck drivers or the aid who has been tested positive or who has been in touch with a community where there were people positive, so that it can help contact tracing. What it shows us is that we should all invest more in innovation. We should all trust the capacity of Africa to innovate and to contribute to the solution. And we should, especially now, in the so many discussions that are ongoing, support the African leaders that are struggling to bring in Africa the capacity to manufacture vaccine, drugs, medical tools to save this pandemic, but to help the continent to be ready for the next one.
Thank you, Dr. Agnes. Of course, innovation is extremely important. And that brings me to Rita and to ask, has the emergency created opportunities for employment, especially in building this health sector capacity? And what should be the priorities? What should be done?
Thank you, Jindai, and thank you to the Mo Ibrahim Foundation for hosting this very, very important conversation. And I'm also very glad to listen to my fellow panelists. I think, Jindai, when you posed the question around what are the top priorities, I think immediately of two in the short term. One is to save lives and livelihoods, because the two in this part of the world, as many of you know, are just so highly interdependent. And in the longer run, the key priority is building both economic resilience, but also increasing health security, which comes to the heart of your question. The pandemic, as you know, is a crisis, there's no question, and it is an emergency. But it's more than just a public health emergency. It also taps right into some of the underlying economics, both the risks, but also the opportunity here on the continent. When you look at healthcare and the health sector as an economic sector and recognize that just the rate of spending right now contributes to about 5% of GDP across the continent, that compares to about 10% on a global average. So even with a rise of health expenditures, that could unlock, 89, $90 billion annually across the continent, and it could unlock jobs, 10 to 15 million jobs. And so at the foundation, as we have assessed and responded to the pandemic, what we've found when you sustain lives and livelihoods, there's been job creation. And as we look more broadly across the health sector, absolutely right now, in the short term, we need human power to stand up vaccination centers. But in the long term, we need to prepare that workforce for a more robust healthcare sector. That's not just in terms of manufacturing, but also in service delivery. And while we have a huge need when we've looked at different occupations over the next decade for doctors and nurses and community health workers, but we also have a need for epidemiologists, lab techs, logisticians, people who manage supply chain, who look at QA, QC in manufacturing, people look at distribution, transportation. These are all jobs where we can actually prepare a workforce, but it's also an opportunity for entrepreneurship. And that is an area I hope that is not lost as we think about the health recovery, but also the economic recovery as we come through this pandemic, as we will. Thank you.
Thank you. Thank you very much, Rita. That's absolutely correct. This crisis is leading to lots of innovation, as Dr. Agnes said, and quite a lot of opportunity for building that health sector, but broader in the economy. So thank you. Gail, turning to you, how can the West better support Africa's COVID response? There's a lot of talk about vaccine nationalism. There's a lot of talk about hoarding in the West. You were there during the Ebola outbreak in West Africa, so you've been on the front lines of this response. What do you perceive as your role in terms of the global coordinator, and what can the West do?
Thanks for that, Jendai, and thanks everybody. I always look forward to this event, and I feel particularly enriched today by being with so many friends and colleagues. A couple things on that, and obviously the first and most urgent is global vaccine supply, and we're pushing out on that. We've announced sharing of 80 million doses. We will have more to say on the specifics of that very soon. We've got a G7 summit coming. Those are always, as many of you know, good opportunities to leverage the collective support and capital of those bodies. And we're working on maximizing the supply, working with producers to increase volume of vaccines produced this year and into 2022. Dose sharing, working on the supply chain. One of the challenges that the world's architecture for vaccine production was built for maybe 5 billion vaccines a year as opposed to the 11 to 14 we're looking at now. So how do we break down those barriers? But also something that was mentioned at the top, Jenda, I think in your introduction, was investment in local manufacture. And we look at this as a short-term play. There are places where the injection of capital could increase local production pretty quickly, but also a long-term play because Africa has a disproportionate dependence for vaccines on those produced outside the continent. So our Development Finance Corporation, our DFI, is actively working on a couple investments in Africa that we hope will come to fruition soon, and is looking at exploring more of those. But if I may, there are a couple other things I would mention. And one is in reference to something that our beloved Madam President said about global health security in the long term. And again, in reference to your points at the top, Jendai, we are working and have been co-hosting a number of meetings on how we get the sustainable financing to build the capacity of countries to prevent, detect, and respond. You mentioned Ebola. Many of us were involved after that at generating resources to build that capacity. starting in West Africa, but across the continent and across the world. What happened? There was some foreign aid available for that. It dwindled over time, and the process broke down. So what we're focused on between now and September is what are the models for sustainable, predictable flows of capital to build that capacity. The last thing I'd mention that we can do, but I think this is a joint exercise, is how do we collectively translate political capital to financial capital? Jenna, you spoke at the beginning about the effectiveness of the response in Africa. And if you look at that, if you look at the AU's leadership, if you look at the leadership of the Africa CDC, which has caused every other region in the world to contact us or Dr. Johnson to say, how do we build one of these, to the supply platform, there's a lot of political capital being expended by the continent in responding to this pandemic and setting up Africa to be in a better place for the future. But we've got to translate that into more financial capital, the involvement of finance ministers, in addition to health ministers, and marry that to the aid that's provided by donor countries, including the US, to figure out how we get on the path we need to have the health systems that can support not only the flourishing and economic growth of the continent, but be the buttress for resilience that's going to be needed when we face other global health threats. So we're working across all of those. I think when I look at a long history of working on these issues, that last one is in many ways the most important collective challenge we have.
Yeah, thank you. Thank you very much, Gail, and thank you for your leadership. It's very helpful to have someone in government and a government that is being proactive and supportive of the multilateral system and cooperation with African countries. So your presence is very welcome. Before we turn to Mandy, who is going to speak for the Now Generation Forum, let me just say a little bit of words about the Now Generation Forum. It's an initiative that the young people demanded of the Mo Ibrahim Foundation, and the Mo Ibrahim Foundation responded quite willingly to creating a forum that's earlier than the governance weekend, just before the governance weekend, that creates a space for young people to debate the very same issues that we're debating in the governance forum. And so it's a chance for, and we call them New Generation, and they renamed themselves as Now Generation. They're not the future generation. They're actually the majority of Africans today. So it's Now Generation. And we really do want to hear from that network. We want to create that space for them to network, to dialogue, to engage, and to act. And so just to give you a little more about that, before we come to you, Mandy, we're going to do a short video from this year's forum, Now Generation Forum, which took place just last week. So we'll turn to the video and then come to you, Mandy.
We need to strengthen investment in innovation, production, and manufacturing capacity in Africa. There needs to be investment in rigorous research pertaining to current and disease X or future diseases. And we need to ensure that our institutions have an ability to conduct valid and trustworthy research. We also need to focus on strengthening the industrialization for our continent, Africa. We need to put in place strategies for social protection to tackle the adverse socioeconomic issues that have stemmed from COVID-19. We're talking about the shadow pandemics, including HIV and AIDS, gender-based violence, and also the amplified negative economic situation.
For Africa to have vaccine autonomy, we have to boost our production, our capacity, and our manufacturing. And I know at the multilateral level, there's a lot of discussion around that with Dr. Ngozi from the World Trade Organization, Dr. Tedros, and they're African. And they're really trying to push that agenda as well, because we are unfortunately dependent on vaccine donations through COVAX, et cetera. And there's a lot of talk about vaccine nationalism, which we all know, and also vaccine apartheid, which is a term, which is a very new term. I mean, it sounds very harsh, but there are talks about vaccine apartheid.
All right. So, Mandeepa, that was quite a buildup.
It was quite a buildup. Yeah.
Let's go back to that very first question. 1 year after the start of COVID-19 and looking forward, what are the main priorities or 3 points that we need to think about and work on and, have all the time you'd like?
Thank you so much. Thank you so much, Jendai. And I'm really honored to be on such a distinguished panel. And I'd really like to thank the foundation for their consistency in facilitating discussions that include young people at the center of the continent's governance conversations. I mean, in the initial Now Generation survey, which was released last year, because the Now Generation network has been tracking the way COVID has been affecting young people for the past year. It's not just been the forum that was conducted on the 27th of May. A lot of the data that was coming out was very stark, but one of the facts that I'm going to pull out is only 48% of respondents viewed COVID-19 as the biggest health challenge in their countries. So mental health, anxiety, the inadequacy of healthcare systems, as well as malnutrition were other high-ranking concerns. So it's clear that we need to deal with health and health capacitation in a multifaceted way as its effects are widespread. So from our last forum, the three big issues that came up were access to reliable data, vaccine hesitancy, and disinvestment in infrastructure. And those are our biggest concerns. On the data, performance of our systems really has to be in relation to research evidence on the ground, as we saw in the video. So latest reports coming out of the WHO in Africa show that less than 2% of Africa's population has received the COVID-19 vaccine. Africa needs an additional 20 million doses within the next 6 weeks to get second doses for all of those received that first dose within the recommended interval. And this despite CDC figures that show that on the 24th of May, 23 vaccine doses have been acquired by member states and only 28 million of those have been administered. And this is only 1.62% coverage rate at continental level. And we need more of this data coming out from our institutions to be mainstream so that people understand the severity of the situation. Sadly, though, we've seen that disinvestment in our technical institutions has really rendered statistical data on healthcare often as an estimation rather than a fact. And this then breeds vaccine hesitancy from people on the ground, and especially young people. So figures ongoing on the impact of COVID-19 show that from November 2020 to April 2021, the willingness to take the vaccine has gone down amongst many African citizens. In Nigeria and Kenya, for instance, there's been a 15% drop. In South Africa, which is on the cusp of a third wave, there's been a 21% drop. So we need demystification campaigns on widespread misinformation and denialism by engaging and strengthening local leader capacities, whether these are civic, traditional leaders, and within our communities through primary healthcare workers and so on. So at the intersection of governance, we then ask ourselves questions as young people, like how can we strengthen healthcare capacities and campaigns when budgeting is not a priority from our governments? In sub-Saharan Africa, we spend an average of 1.9% on GDP on public health expenditure. So this is far below the global average of 5.9%. And these are figures coming out of the Forum report. Corruption as well is a problem. Across the continent, this remains a massive problem. How do citizens place their trust in governance who are meant to hold up social contracts when corruption has been rife amongst government officials during the pandemic? The health minister in South Africa, who was lauded for his performance at the beginning of the pandemic, is now facing charges amounting to massive sums of money and is facing criminal charges because of misappropriation of funds. No wonder approval of governments has gone down, and insufficient domestic political participation has been the sentiment from young people on the ground. This all has a trickle-down effect. As we've seen throughout the pandemic, a healthy and vaccinated society is the only way to bounce back from the socioeconomic effects of the pandemic. How can we be conducting or talking about issues such as the African Continental Free Trade Area, how can those proceed when the priority is not being placed on healthy citizens and, you know, their growth during, you know, to capacitate socioeconomic issues. So capacitating healthcare systems is very clear that we need to capacitate all systems. And COVID has shown us that healthcare is multifaceted. Capacitation is across economics, agriculture, and it must be built in this way. You know, this brings me to conversations around investment in healthcare infrastructure. How can we lobby these for strong infrastructural development? You know, we speak about the need to upscale digital innovation and technology, yet we lack the infrastructure and the political will to support that infrastructure. Tapping into Africa's already expansive mobile market through standardized e-health tracking tools, such as those created across the continent at the beginning of the pandemic, could really be a way to facilitate general, good research, data collection and investment in our institutions and infrastructure as a political priority. And just to wrap up, we really need to push, and I'm here to plead for a call, not for intergenerational conversation, which is usually what we call for, but intergenerational cooperation. There are young people on the ground doing things that people at the top who have seats at the table are talking about, but there's just no communication and cooperation in that regard. In a crisis, we need to find opportunities where we can lobby each other's, where our lobby capacities and our skills across generations can be merged and mainstreamed accordingly to build back better. And COVID has really been a great illuminating force to the urgency, to the challenges that we face on the ground. It would really be unfortunate if we were to be counted amongst those who saw the challenges at hand with the resources to change them, research capacity available, and the political networks to address them, but we didn't leverage our strengths. Thank you.
Wonderful. Thank you very much. That's the reason why we have you on this panel. We appreciate your voice. What I'd like to do now is to bring in the front row. We have a lot of distinguished guests here who also have tremendous insight into this issue. And I can see one of them is traveling. So we definitely want to hear from him before he takes off. But we have Aliko Dangote, who's the traveler. I think Mo Ibrahim is here, though I can't see him. We also have Professor Adamu, who is with us, and we're looking forward to hearing on the ground from him what's happening. Patrick Youssef, the director of the International Committee of the Red Cross. I don't see Mary Robinson. We also have Martin Sichel, who is the Delegate Director General of the International Partnership Department of the European Commission, who's specifically in charge of health manufacturing in Africa. So these are some of our guests here. I see we have Ms. Yusufu as well. So why don't we start with Aliko? Do you have any comments on what you've heard, what our priorities should be, what you're doing, what our next steps should be?
Yeah, thank you very much. It's great to be here. Yes, it's true, I'm flying, so maybe you can hear a lot of noise. I hope it's clear. Yeah, we did quite a lot in terms of at the beginning of the COVID. And, what we did was we mobilized the private sector. Well, I did actually, I mobilized the private sector, and we raised about $112 million within the span of about 2 months. And what we did was to go ahead and, build isolation centers, because I'm sure you know about our medical facilities in Nigeria. So what we did, we built 39 isolation centers, fully equipped with all the equipment, so that I don't have to go in detail. And then we bought about 10 million, we bought food items for about 10 million people. So what we did, we took the bottom line of the population and we went ahead and, but because of the restrictions of movement, so a lot of people couldn't go out to look for, to work and get money to eat. So what we did was to buy food for them. And that meant 48 or $52 million out of the $112 million, and we distributed to all the families across Nigeria. And then we paid a lot for the testing, which they tested at least about almost about 1 million test kits from our own organization, which is called Corporate Against COVID-19, CAPOD. After doing that, we now also design a system of how to open the airport, how to allow people to come into the country, because it was a little bit of confusing. We were confused as how to open the airport. And what we did was to work with the government task force to open the airports, where now people were allowed to start coming in, were testing them at the airport, setting also the portal of how to feed in your information before coming into Nigeria, because what we did was now to design. Before coming into Nigeria, you must test 72 hours before arrival, and then you isolate for a week, and then after the isolation of 1 week, now we go and take another test. So all these ones, we did that. But the cameras, what we did was to now buy, but that's Dangote Foundation. So Dangote Foundation paid for all the cameras at the airport to take temperatures and also to detect who has COVID or not. That one we did, I think, right during the Ebola. So we just updated the system. So this is really in a nutshell of what we've done, but we're still very much involved on a daily basis. Thank you.
Thank you very much. And again, thank you for your leadership. We need to hear more about what the private sector is doing and playing such an important role. I heard a lot about Jack Ma, but I need to hear more about what you've done, and I hope that message can get out. That's really tremendous. Now we do have Mo in the studio. So Mo, would you like to give us your perspective? Give us your welcome. We appreciate you.
Well, thank you very much. And can you hear me? Yes?
Yes.
Okay, thanks. Really, thank you very much, Jindai, for all the work you've been doing, and thank you very much for our wonderful panels, really. I listened to some very, very wise words. I really prefer to pass the chance to some of our friends on the front row. I've already spoken. I don't want to suck all the air in the room. So let me continue to listen, and let us hear more views from some of our distinguished guests.
Wonderful. I really like to open it up. I don't want to be just asking questions, answering questions. I really like to have a discussion right now. But maybe Professor Adamu, you can tell us a little bit about the figures in Africa. Dr. John spoke to it as well. You're the head of a major hospital in Niger. What are you seeing? Are the numbers as low as we say? The numbers in Niger seem to be very low. What has been your experience?
Hello. Can you hear me?
Yes, we can.
Okay. So I want to talk about the Nigerian Miracle, because in Niger, we just have 5,000 cases, positive cases, and 119 people dead. So what about Niger? I want to talk about 4 points. First, the anticipation and prevention. Second, synergy of action. Then the therapeutic choice, because in Niger, you made quickly a therapeutical choice. And for the last point, it's an hypothesis of a probable environmental and immunological factors. So in Niger, we have to congratulate the visionary spirit of the President of the Republic at this time, Issoufou Mahamadou, who had taken very quickly early measure early on, even before the first case will appear. So I can tell you about the free care of all peoples. Nobody will have to pay. We can have the early designation of the main care seat, the detection kit, the isolation seats and the hospitalization seats even before the first case will appear in Niger. The early border control to detect imported cases at the early stage. So you have an early provision of the prevention kits like gels, like control device and the others. Second, I want to talk about synergy of action. What did I say, synergy of action? It's because in Niger, the medical world and the political world spoke the same language. Everyone at the beginning of the pandemic was moving in the same direction, and the well-being of the population was at the center of the debate. And I think that this is the reason that made a very quickly availability of the resource. I talk about the therapeutic choice. So what is therapeutic choice for me? You know, in Niger, you have a scientific council. The scientific council quickly made the choice of prudence and proposal a therapeutical protocol which reassure the patients and whose complements are all known by the medical team of Niger, offering a treatment for a pathology, a new pathology that was rumored to be incurable. I think this is an obligation to avoid a general panic and the refusal to come for the treatment. Because if people means that this pathology is not curable, they always said it's not necessary to go to the hospital. If I have some things, I will stay home. And this is not good for the contamination. The last point is an hypothesis. The hypothesis of probable environmental and immunological factors. You know, in Niger, people have a lifestyle in a large space. There is no promiscuity. And these things can go down the contamination. After this, we make the possibility of an old contact with a coronavirus strain, making African subjects less sensitive to the new variants of this pandemic. Because in Niger, many peoples have domestical animals. And we know that domestical animals like camel, like pangolin, can have a strain of coronavirus. So maybe this is give African peoples a relative immunity and make them less sensitive for this pandemic. I want to talk about vaccine. Yes, about vaccine. Because about vaccine, we can say that nobody will be safe until the neighbor are also safe. Now for vaccine, I think there is a need to produce African vaccine in Africa. This is to facilitate access for the vaccine and to build African confidence in the immunization process. Because now many African peoples don't make the vaccine because there are no confidence in the process of vaccination. Now there is surely a lesson to learn from Niger, lesson for anticipation, lesson for synergy of action. But what I want to say in the end of my intervention is that if the world really wants to cure the COVID-19 pandemic, Africa must be put back in the center of the scientific research. If I say in the center of scientific research, in the center of research for vaccine, for drugs, for events like monitoring events, like intensive care events. And so if you do this, maybe you can fight COVID-19, and I think it's a good thing.
Thank you.
Okay, it's what I want to talk about.
Thank you. What I'd like to do is stay with sort of, what's going on the ground with Patrick Youssef. And then what we will do is really get into this question of the vaccine manufacturing capacity. And we will go to Martin and to Pascal Lamy at that point, talk about global governance, and then bring the conversation to that. We have about 40 minutes or so left, but we also have videos that I'd like to show of Dr. Peter Piot and Ngozi Okonjo-Iweala, which will also wrap up this issue about the vaccine as well. So why don't we go to Patrick Youssef and tell us what are you seeing in Africa as well, and then we turn to vaccine.
Great, Jendai. Thank you very much. I hope you can hear me. Yes. I will try and attempt answering your initial question on the systems, on the weakness of systems and what we should do because of the pandemic to move to a different era. I think what you've said is very important in the beginning. COVID was, or should I say is a revealer of weaknesses, but mostly an accelerator of trends. Weakness trends are accelerated all over the African continent, and the threat today is still very much real and could be devastating. And here I would like to zoom in on areas affected by conflict and violence, or where healthcare systems are quite weak. I think we're still learning, we're still studying the full impact of the pandemic crisis, which may not appear for many years, particularly in low-income countries where factors such as poverty, lack of vaccines, weak health systems, but also high population density, increases the risk for COVID-19 and related harm to spread. For example, and as said by Dr. John from the Africa CDC, measuring the excess mortality alone offers only a partial insight into the impact of COVID-19 on the health of nations. And here, a key challenge, and we've all been discussing that, is the impact of COVID-19 on the younger people, meaning what are the risks of long COVID, what we call long COVID, considering the demographic distribution in Africa. We need to ask ourselves what impact this will have in terms of workforce capacity, but also healthcare demands, which are still quite unknown. So, and I think Mo Ibrahim has been very transparent in all his years, and I would like to use this opportunity to say, if we are serious about strengthening of health capacities, we must be inclusive of those affected by wars and various forms of violence. We do have today a space in Mozambique, Somalia, South Sudan, Darfur, Lake Chad, Libya, and the Sahel, and many places where health structures and infrastructure is devastated and even attacked by armed actors. So here we should be able to follow the same logic that push us to say we need to have equitable access to vaccines. And we all repeat, no one is safe until we're all safe. And I would dare say, indeed, building resilience means building shock-resistant systems through partnerships, but also through proximity to those in need. And us at the ICRC, the International Cross, but also national Red Cross organizations have been responding to the social and economic effects of COVID-19 on the different populations, but also working on systems in where development actors should be present, and as ICRC trying to bridge the gap between humanitarian and development. And here in full transparency, again, I think the development of these capacities have to be done in a manner that ensures sustainability to the long term. And so avoiding investments in what we call white elephants that must be suitable for today's surge of needs, but also should be still very valid in tomorrow and the years to come in order to create a stronger and more resilient African context. Back to you, Jendai.
Yeah, thank you very much. And that picks up very well on the points that Gail was making as well about the need for that sustainability. Let's now go to Martin. Can you talk to us about, what is the European Commission's view on manufacturing vaccines and, supporting Africa's capacities in terms of the health sector and also the manufacturing of these vaccines?
Yes, thank you. Indeed, as has already been said, this pandemic has exposed many difficult realities, one of which is the deficit in production capacity and the fact that Africa is a net importer of essential technologies, including but not just vaccines. And this is indeed an area which is now, very high on our priority, because it's not just a problem for Africa, it's a problem for the whole world, frankly, because having an important continent like Africa exposed in this way is also a vulnerability for the entire world. So there's a real interest to address this and help Africa address this issue. Now, of course, there's a supply side and a demand side issue to this. On the supply side, of course, there is an important need to help facilitate and also incentivize, de-risk, etc., investments by the private sector in Africa. We believe that there is a lot that we could do there through the various financial institutions. For example, the European Investment Bank is already very active in this area, but also through helping Africa set up, for example, instruments for joint procurement of vaccines and other essential countermeasures, as indeed has been our own experience in Europe. And that is something which is why, for example, we've strongly supported COVAX from the very beginning, including not just through donation of those, but also financially. But I think that a mechanism like that is very much needed. On the demand side, there is also an important need to help address the regulatory environment in Africa, because the pharmaceutical industry is, of course, and must be a highly regulated industry. And therefore, the relationship between industry and regulators is extremely important. And Africa has 50 plus countries. And therefore, there is always this risk of fragmentation. Now, the African Union has taken already a very important step to establish strong regional agencies. We know the excellent work being done by the African CDC under the leadership of Dr. Nkenga Song, for example. It has quickly established itself to become a point of reference in Africa. And there's also the decision taken by the African Union to set up also the African Medicines Agency. And this is, again, an area where Europe stands ready to help. We are ourselves a regional model of pharmaceutical regulation through the European Medicines Agency. I must note, however, that until now, only 8 African countries have so far ratified the AMA agreement. And a few more are needed to bring this important infrastructure into being. And this is important because obviously it is, as I said, a highly regulated industry. It requires a constant interaction, guidance between the industry and the regulators. And also a strong African Medicines Agency could help build up capacity, certainly at national level, build up the expertise. But more than that, this is an opportunity for Africa, I would say, because this is not just about, should not just be about an industrial policy to have some more industrial production in Africa. Africa must be fully integrated in the global circuit of research, development, and manufacturing. And this is really important because we have, at the moment, some really groundbreaking technologies that actually could help us resolve some long-standing health issues. Important areas of unmet or poorly met needs. We know, for example, the high burden from certain infectious diseases in Africa, diseases like malaria, tuberculosis, HIV/AIDS, but also other diseases which are not yet attracting sufficient research and investment in research. So this is an opportunity for Africa because a strong regulatory setup could help also attract a research effort. Just to give an example, to help organize the governance of research, clinical trials, etc. in Africa, addressing African health priorities. This is really important because this should not just be about an industrial policy. This is about also addressing these issues. And also this is an opportunity for industry itself because many of these technologies, if I take, for example, the mRNA technology, which everyone now is talking about, to have a sustainable investment, it cannot be built on just one vaccine. You would need to construct a pipeline of applications, different applications of the technology to address different diseases or different health objectives. That is what would give sustainability. And indeed, we firmly believe in the Commission that if all the elements are brought together, Africa could indeed be in a very good position to not only attract, but also to offer an attractive environment and would really be in a good position to really facilitate this technology transfer, because this is what it's all about. It's about also ensuring that Africa gets the latest generation technologies. And many of those technologies, mRNA, immunotherapy, etc., are perfectly suitable for many of the health issues that Africa is dealing with. So we of course are working with international partners on this, but primarily this has to be, of course, an African-led initiative. We would very much, of course, express our full readiness to support. We stand ready to support in every possible way. And we think that actually Europe can be an excellent partner for Africa, given that we ourselves are a regional model and we have gone through many of the same processes ourselves. So thank you.
Thank you very much, Martin. And it also gets back to Dr. Agnes's point about how innovation is coming from Africa, and Dr. Adamu's point about how that research has to be driven locally, because we're all one community. And so really this research has to be shared back and forth and generated from all sources possible. Pascal Lamy, what do you have to say about all this? You do a lot on global governance. You're the former WTO Director General. What can we do? What should be our priorities?
Three short points.
Your audio is a little crackly, I should say.
1, 2, 3, 4, 5. Is it okay now?
It's still a little crackly.
Well, look, take another one, and I'll fix it and come back.
Okay. All right. We'll come back to you. Maybe I'm going to open the floor right now, or you know what I will do? I'm going to turn to 2 videos. Why don't we have Peter Piat's video, and then we will have Dr. Ngozi's video, and then we'll come back to the conversation. And I really do want to open the floor to cross conversations. And hopefully we'll have Pascal Lamy.
Hello, everybody. Thank you very much to the Ibrahim Foundation for your leadership and for inviting me to join you for the 2021 forum. I'm only sorry I couldn't be here to join you live. Africa has much to be proud of in its response to the pandemic. Leaders responded early and in a coordinated manner with swift implementation of public health measures. And when it comes to epidemics, early action is critical, no time to lose. But I fear that the devastating COVID crisis in India is a window into the not too distant future for other parts of the world. Many other countries are facing serious outbreaks, and future epidemic waves are likely, particularly in places with low vaccination coverage, not to mention the threat of new variants. The top priority now is to ensure global vaccine equity. This is not only a moral imperative, but critical for pandemic control everywhere. Effective and equitable vaccination programs and, crucially, widespread acceptance of vaccines are essential. So too is scaling up access to other medical tools, such as diagnostics, medicines, and oxygen. In the short term, we need leaders to step up funding for the access to COVID-19 tools accelerator, and particularly COVAX, and high-income countries to share large numbers of vaccines because they have too many. Strengthening regional manufacturing capacities is also essential. Not only to advance equitable access to COVID vaccines in the near future, but it will also strengthen our collective health security. Now, I would like to warmly congratulate the Africa Centers for Disease Control and the African Union for their leadership in this regard. I was pleased to see the AU and CEPI to join forces to boost Africa vaccine R&D and manufacturing with a recent memorandum of understanding. And Dr. Ursula von der Leyen, the President of the European Commission, also announced at the Global Health Summit in Rome last week a 1 billion Team Europe initiative on manufacturing and access to vaccines medicines and health technologies in Africa. This will require solid partnerships, including the private sector and public sectors. And there are many more initiatives underway. Action and investments to control COVID-19 today will also build a foundation for stronger preparedness and response against the ever-present and real risk of another health threat. Thank you and best wishes for an inspirational forum.
And now we'll have Dr. Ngozi's film as well, or video.
I'm sorry I cannot be with you for this Mo Ibrahim governance weekend due to conflicting engagements, but I would like to share with you a message about the multilateral trading system and WTO and their contributions to solving this pandemic. First, I'd like to share that trade has already contributed in helping to move medical supplies and equipment around. After the initial disruption of supply chains at the beginning of the pandemic, and despite the fact that trade shrank by 7% in value in 2020, trade in medical supplies and equipment actually grew 16% by value. For personal protective equipment, it was 50%, and for face masks, over 200%. So all in all, trade helped to move medical supplies and equipment around. But trade and the WTO can contribute even more in three ways. First, with regard to export restrictions, WTO members can lower these export restrictions so that supply chains can move even better. At the beginning of the pandemic, we had 109 export restrictions that were put in place by WTO members. Happily, this has now come down to 51, but it's still too many, and we can do better. So lowering export restrictions to help supply chains move is very important. The second contribution is with respect to manufacture of vaccines. And one of the key things we did was to have a vaccine manufacturers conference a month ago, bringing the manufacturers together with government, with civil society, with WTO members to have a dialogue. And at that conference, we found that there's actually existing capacity in some emerging markets and developing countries to increase the production of vaccines. Because what we have now in the world is a serious supply constraint. So investing in turnaround capacity in existing emerging markets like Bangladesh, Pakistan, South Africa, Indonesia, Senegal will help to increase volumes of vaccines available. And then investing in longer-term production capacity is also very important, and we agreed on this. In particular, because the export and production of vaccines is concentrated. 80% of vaccine exports come from 10 countries in North America, in Europe, and South Asia. And we've seen that that concentration does not work. It's anomalous that a continent like Africa with 1.3 billion people imports 99% of its vaccines and 90% of its pharmaceuticals. Production of vaccines and pharmaceuticals ought to be better decentralized. We've seen that that is what is needed from this pandemic. And certainly the WTO can work with manufacturers of vaccines and other medical supplies on the issue of keeping supply chains free and flowing in order that we can expand manufacturing and have access to raw materials and the supplies that are needed. The third aspect is transfer of technology and intellectual property, the debate that is now going on at the WTO for the IP waiver. Of course, as the DG WTO, I cannot take sides in the waiver debate. My job is to bring our members round to concentrate on negotiating a text. The faster we can do that, the better. We also need transfer of technology to accompany any intellectual property waiver, because alone that cannot lead to production of vaccines. So transfer of technology, some agreement on what we do with the IP waiver to assure developing countries near automaticity in access but at the same time protect research and development. I think this is what we need. So 3 ways in which the WTO, with its rules and the multilateral trading system, can contribute. What we would like is for everyone to support WTO members to come round the table and negotiate the text on the IP waiver, and also agree on a framework for trade and health, both for the pandemic now, but also going forward into the future. Thank you.
Okay, I think that brings us to Pascal. We really do appreciate, again, the leadership of Peter and Ngozi, Dr. Ngozi. Pascal, you used to hold her seat.
Yeah, it's an office. She was speaking from a place I know well. And by the way, thanks to my sound problem, which I think I have fixed in the meantime, because it's better for me to speak after Peter and Ngozi, who said the essential. Three short points on the discussion. First, of course, and we've heard a lot of that, and this is absolutely correct, Africa needs African vaccines. Africa needs more health investment, expenditure in the years to come. This is absolutely clear, and a lot of this has been said. I fully agree with that. But, and that's my second point, there is an emergency to provide vaccines in Africa. And by the way, in other places in the world, in developing countries, Africa being our focus. But as you know, Latin America is in a much worse situation than Africa for the moment, and this cannot wait. So good to discuss how capacity can be built, how investment can increase, but what needs to happen is a short-term effort to provide finance and vaccines for Africa. It's not a question of years, it's a question of weeks, maybe months. And the reality, and I've said that publicly already as the chair of the Paris Peace Forum, we are on the verge of a vaccine apartheid, which is absolutely intolerable. What should and can be done entails a big uplift in global governance. Yes, we have COVAX. Yes, we have WHO. Yes, we have WTO. Yes, we have the World Bank. Yes, we have the IMF. We need these people to work in common with a war room. This is exactly what Kristalina Georgieva has suggested this week. As you know, she's teaming with Ngozi, with Malpass, and with Tedros to try and set up something of this kind. Believe me, I've been in this business for years and years. If there is not a major change in the way this is addressed globally, Africa will wait 1, 2, 3 years. This is intolerable. The G7 was mentioned. I know we have a G7, but let's be very frank, the real place to decide this and to push for that now is the G20. With an Italian presidency, it's a European country, they have a lot of goodwill. Let's all push for this to happen. And then maybe the sort of dire situation we are now will evade. Third and last point, because this is an optimistic one. Many of you know, and Ibrahim is the first one to know, that I've always been a bit critic of the AU level governance for Africa. It's, in my view, way too weak. But the good news is that in this case of COVID, the AU level governance in Africa has made a big difference. This is not a Sunday speech. This is what we've seen on the ground. This is what has happened. So there is hope in this area. And I really want to pay tribute to that because it's, I wouldn't say it's exceptional, but in an area which is so crucial for the future, we have a consistent, expert, loud AU level, and that's great in my view. Thanks for your attention.
Thank you, Pascal. Those are, absolutely important points that you've made Dr. Kangason, can I come back to you? You know, in many ways, Africa CDC has become the point institution for the continent, working with the strong leadership that we've seen out of people like President Cyril Ramaphosa and others, even the institutions like the Africa XM Bank. Are you at the center of the discussion of these global institutions about how to really build that capability and respond to the emergency, as Pascal mentioned, the need for vaccines now, whereas, you know, we keep hearing about the supply is short, and so therefore Africa just has to wait in some ways. Are you at the center of those conversations? And if you are, what is your driving message?
So thank you, Ajay. I have two messages, and especially targeting the leadership of the G7 that will be meeting very shortly. One is, as others have said, we need vaccines now, and we need it quickly on the continent. And anyone who has excess doses of vaccines, the time is now to redistribute those doses so that we can vaccinate our people at speed and at scale. We need that. And if we do not do that, Africa will actually and definitely be moving towards endemicity of this virus on the continent, a continent of 1.2 billion people, and that doesn't bode well for our collective global health security. Second is the manufacturing that others have said. On April 12 and 13, you may recall, we convened the vaccine summit, where about 40,000 people showed up on that platform for 2 days. And we just came to a consensus, of course, that the moment was now for the continent to exercise leadership, build the right partnerships, and begin to manufacture vaccines. You've quoted all the data. I don't need to repeat the statistics, but no people in the world guarantee their health security by depending on others. Let me be very frank with this. I'm not a politician. I don't know that anyone can produce vaccines and instead of protecting their own people, export the vaccines to another part of the world. So that means Africa, the argument about Africa producing its vaccines, diagnostics, and therapeutic is real. It means we have to regionalize it, decentralize it, so that we can all work collectively to enhance and strengthen our global health security architecture. So two messages are: redistribute those vaccines quickly, and secondly, support Africa in its endeavor to build vaccine manufacturing capacity.
Thank you. Thank you. Does anyone else want to? I'm going to open up the floor to the panelists. Does anyone want to make a specific point on this issue? Yes, Dr. Agnes, and then we'll have Gail and then Rita.
Thank you, Jedi. I just want to compliment my colleague from Niger, that the many countries in Africa have succeeded because of what has been done. And also for this, thanks to John, who have called our ministers of health before the first case on the continent to say, take it seriously, don't do like some other countries are doing. And also, many countries start to do the right thing before the first case. In Rwanda, it was 3 months before the first case, contact tracing, etc. So this is something. And also caring about the vulnerable, reducing taxes for everybody, and give cash for those who are too poor to eat so they can remain in lockdown. There was a lot of things done that has made that a real success. We should not undermine. And for Pascal, you are right. African Union has done great. Remember 2014, thanks to African Union also. So don't say it's now. African Union is blocked in many ways, but really when they move, they are moving well. And in my university, the University of Global Health Equity, we can prove all this. So just what I want to say, great panel, great things said here. We should expand and stop thinking, oh, we just do good now with this. Oh, no, we are a great continent and we will prove it with the time coming.
Thank you. And share lessons of the success with America and Europe as well, and Asia.
We have a Absolutely. And I love that. I'll be in your continent in 3 weeks from now. And this is my objective.
Yes, we have to share lessons globally. Gail, please.
Thank you. I just want to come back to the manufacturer with a couple of quick points. I think that obviously vaccine manufacture is critical and mRNA technology is critical because that's going to be, I think we all know, a global game changer over the coming years. But I think widening the aperture also helps. I recall early in the pandemic being in a meeting with a number of you looking at the stats on the level of dependence across the board on vaccines, therapeutics, and medical supplies. And I think as this push is made on investment in vaccine manufacture, widening that aperture, including because you can tie that to jobs the more that the actual production is expanded. I just want to underscore, I think there is real and significant interest from across development finance institutions, and they're able to help with some of the risk issues. They've got debt and equity in many cases. Fortunately, we finally got that in the US. So I think, again, that interest is there. I think there's some ways to capture that interest. Expand it, vaccines, complete with technology transfers, but across the board. On medical supplies tied to jobs. And I think when there are cases where there is evidence of a strong African investor as part of a deal, that enhances the opportunity even more. I can tell you one of the things I've been doing among many is talking to other DFIs to see if there are ways that we can aggregate capital to do some of the kinds of things you're talking about here. So I think if we can think about how do we craft a package and a vision and tie it to the other pieces, I think there are ways to move some of the capital in to get this moving.
Exactly. Absolutely. Thank you.
Thank you.
Rita.
Gail, you stole my thunder, but that's great. I'm all glad we're there, sister, you know, in terms of what I was thinking about. So absolutely, just to build on John and what Gail said a moment ago, you know, redirecting of vaccines, rolling out vaccination campaigns, addressing vaccination hesitancy, but the hard work of that delivery is absolutely critical, followed obviously almost concurrently the discussions around manufacturing short-term and longer-term. But the one thing which is really key is building strong institutions. And we have a fantastic leader in the area of Africa CDC, but there are many public health institutions. They are the backbone. And in times of crisis, we need to turn back to those institutions to lead. Across the board, all of these things, whether it's vaccination campaigns, manufacturing, building institutions, and the good news is if there is funding coming in terms of serious investment in infrastructure, it will all need a workforce. It will need a skilled workforce to meet that challenge. And so I just want to make sure that we don't forget that part too. Thank you.
Absolutely correct. We have about maybe 5 minutes left. Is there anyone else who wants to make a brief intervention? Mandy, just do you have a brief intervention, or President Ellen? Would you like to, you know, is there some points that you want to make just before we close? President Ellen, I see you looking like you might.
Unmuted. I think I'm unmuted now.
Yes.
I think Africa has done really well. The leadership of Africa have been able to, not only based on the experience of the previous Ebola crisis, really acted very quickly in keeping the protocols to ensure that the prevention has. I think we owe a lot to them for what they have been done in bringing the private sector together. Dankoti mentioned the thing about what they had done, but I don't think the whole message of being able to start the process of manufacturing in Africa has been done through the private sector that has connected with South Africa and with Johnson & Johnson to start the processing. So actually vaccines have been manufactured in Africa. So what we need to do is to expand on what's already been done, identify the others where the capabilities are, and move in that direction. And finally, I think we ought to listen to the example of the action that was taken at the recent France Africa Union summit, and the specific actions that came out of that to respond. If we can get some of the other partners to be as very concrete and clear as that, I think we can then move very fast toward meeting the two major things that have been identified, and show we stop the transmission through vaccine and vaccine redistribution, and also through encouraging the manufacturing in our own country. So thank you. It's been a great panel, lots of information, lots of exchanges.
Thank you. Thank you very much for that wisdom. Amanda, you have like two minutes.
That's absolutely fine. I just want to say I'm really encouraged that the things that we speak about every day at my level of engagement are the same conversations that are being had at high level. But just one thing that maybe wasn't brought to the fore when we were speaking about research is the statistics say that less than 1% of global research reported on Africa is done by Africans. So I just want to challenge everyone on the panel to think through how we can best leverage ally institutions, both in the global north and in the global south, to see how we can best amplify knowledge outputs being done by Africans on the work that they're actually doing, and how we can feed into best practices that we're seeing both in the global north and the global south. And really just to reiterate that we need to push towards intergenerational cooperation and not just an intergenerational conversation, because this is an action process and not just talk at this point.
Absolutely, couldn't have said it better. Let me just close. This has really been a fantastic panel. It's a great start to the governance weekend. I appreciate all of the knowledge that you've all shared with us today, as well as the hard work that you've been doing. I know that everybody's been working so hard over these past 2 years and have so much more to go. So thank you for that work. Again, just to recap, and we really need to build the health sector capacity as a priority. There has to be decentralized production of vaccines and pharmaceuticals, and we have to pay attention to prevention and preparedness, especially at the institutional and leadership level. And so I think those are probably 3 takeaways that both the research supports and this conversation is supported. But again, thank you all very much. And I'm going to hand it back over, I think, to Zainab, who will take it from here.
Thank you so much indeed, Jendai. Mo and I have been here in the studio in central London and listening all ears to you and your terrific lineup there. Some real insights that we gained today. And as you say, we have a crisis to respond to with hopefully the global cooperation that we've all said is badly needed. But also it is a wake-up call, as you say, Jendai, for Africa to really put some muscle and money into its health systems, and it's also hopefully a rallying cry to ensure that Africa does achieve self-sufficiency and self-reliance in meeting its health needs. So some real clear ambitions, goals and objectives there, and let's hope that the COVID-19 crisis also presents us with an opportunity to really bring about some much needed momentum. So coming up next, really, to conclude our first day of the Ibrahim Governance Weekend, we're going to have the leadership ceremony. So stay tuned. And Mo, did you want to say anything, Mo, or are you all right?
Well, I really want to thank you for a wonderful conversation. And everything you said here really strikes a nerve here. And many of these issues what we have been fighting for. And yes, the leadership demonstrated by some of our, actually many of our leaders, forget about the 2 or 3 guys who denied it, and actually many of them died. But Most of our leaders really did show leadership. That's one, but that needs to continue. We need that African voice coming together. And we talk about manufacturing vaccine in Africa. It is very important. We need to have one regulatory regime. Just one regulatory regime. We cannot have 54 authorities. Also, we need to open our borders to each other. So what's the point of manufacturing vaccine? And then are able to move it to the next country. So the trade, we need to move towards a common market as soon as possible. That's important, not only for the vaccine, for our GDP, for our jobs, for everything. We need to really do things right. A remark about correctly, there is vaccine manufacturing in Africa, and I heard about Johnson & Johnson facility. But you know what? People discovered that the production there, 100% of it was going to United States. They said, we have a contract. And after arm twisting, they said, okay, we're going to leave 40% for you here in Africa. We take 60% to United States. Think about that. Just manufacturing in Africa is not enough, because this can be factories, again, sending vaccine to Europe and the United States and not for Africa. We need to think of a system, a regime, which enable us to really have equitable distribution of vaccine for everybody. And it was clear, yes, we understand that politicians in rich countries, they have elections. I mean, they'll try to vaccinate their people first because it is important for them to do that. But what we're hoping that at least the key sectors in Africa or elsewhere, health workers, those people should have been vaccinated immediately, at least to save our very fragile health service, given that actually more African doctors work in Europe and United States, actually more than the doctors working in Africa. Can you believe that? The first doctors died in UK were Sudanese, treating people here in UK. So there are a lot of issues here to really think about, but it has been a wonderful session, and thank you very much. And I just want to thank our all wonderful panelists.
We're all joining you in the applause. Thank you so much indeed, Mo, for rightly reminding us that this discussion about COVID-19 has many facets and dimensions to it, and we've really got the ball rolling in bringing all these subjects to the fore. So, as I said, next we have the leadership ceremony, and look forward to seeing you shortly. So thank you all very much, and see you in a minute.